Good morning, this is 97.7 The Bolt. It is Tuesday, so it's time for the Humboldt County Memorial Hospital show. And this morning we've got a couple of different things that we're going to talk about. First up on the docket is COPD and what it is and how it can be treated or maintained.
Sure. Hi, Emily. I'm Courtney Palmer. I'm the Director of Cardiopulmonary Services out at the Humboldt Hospital. And I asked Gary if I could come out and talk a little bit today about COPD. COPD stands for chronic obstructive pulmonary disease. Mm-hmm. Does that make any sense to you, Emily?
Not really.
No. So I thought I'd just break it down for people a little bit. That's a lot of big words all in a row. So chronic means it won't go away. Obstructive means partly blocked. Pulmonary means in the lungs. And disease means sickness. So when somebody has COPD, it means that you have a sickness that won't go away where your lungs are partly blocked. Mm-hmm. So COPD is the fourth leading cause of death worldwide, killing nearly 3 million people every year and hospitalizing even more. I know in our emergency room, I see somebody with COPD on a daily basis.
Wow.
So tomorrow is actually Worldwide COPD Day, and it's basically just to let people know that COPD can be treated. Mm-hmm. So symptoms of COPD include coughing, maybe bringing up some mucus with that cough, and getting short of breath with daily activities. There's a stigma around COPD that it's a smoker's disease, and that's not necessarily true. People can develop it if they've been exposed to asbestos. Back in the day, farmers and people in factories, they didn't have the protection that we have now, so they may have been exposed to fumes and different chemicals that did some damage to their lungs. COPD can be diagnosed with a quick, painless pulmonary function test or spirometry, and the test is really as simple as blowing out candles on a birthday cake. I do all of the pulmonary function testing out at the hospital. I've been doing it for almost 10 years, so I've gotten pretty good at it, and it really is a simple task, and we can get you diagnosed very quickly. So tomorrow, in recognition of World COPD Day, we'll be offering free screenings in the cardiopulmonary department. So we're located right inside the first two double doors when you walk into the hospital, or you can go up to our front desk and ask one of the girls up there where we're at, and they'd be happy to help you find us. Anybody in the community is welcome, and we'll kind of be ready for you between 8 a.m. and 4 p.m. So we'll just come back, fill out a form, do a quick screening, and then go over the results with you and direct you in the right direction.
Okay. All right, so we're going to take a quick break here on 97.7 The Bolt, and we will be back to talk with Courtney more here on the Humboldt County Memorial Hospital Your Care, Our Mission show.
Early detection close to home. It's one screening test and it may save your life. Hi, I'm Andrew, one of the surgery team members from Humboldt County Memorial Hospital. If you're over 50, this message is for you. According to the American Cancer Society, colon cancer is the third most common cancer diagnosed in both men and women in the United States, and it's the third leading cause of cancer-related deaths. A screening colonoscopy may save your life, and it can be done right here, close to home, at Humboldt County Memorial Hospital. Dr. Adams, a specialist in gastrointestinal disorders, performs screening colonoscopies and other gastrointestinal-related procedures in the Outpatient Surgery Center at Humboldt County Memorial Hospital every Tuesday and Thursday. Ask your family doctor or call Humboldt County Memorial Hospital at 332-4200 if you have any questions or would like to schedule your colonoscopy. Remember, if you are age 50 or older, or you have had a family member that has been diagnosed with colon cancer, you should consider an exam. Prevention and early detection are the key in saving lives. The next save could be yours.
This is 97.7 The Bolt. We are back with the Humboldt County Memorial Hospital Your Care, Our Mission show. And I was just talking to Courtney. She was talking about the COPD. Tomorrow is World COPD Day, so they are offering some screenings for free to help you out and maybe help you figure out what's going on with you if you might have it. And she said that pulmonary rehab can really help out with COPD, right?
That's right. COPD doesn't have a cure, but there are medications and therapies that can help you feel better and slow down the damage to your lungs. So first of all, early diagnosis, like with a lot of things, is key. Second, being prescribed the right medications so that you can eliminate exacerbations. And people with COPD probably know the word exacerbation. It means when symptoms get worse over a short period of time, which can cause permanent damage to your lungs. And then thirdly is pulmonary rehab. So out at the hospital, we offer pulmonary rehab to patients that are suffering from COPD, as well as a variety of other lung problems. Pulmonary rehab is staffed by myself. I've been a respiratory therapist out at the hospital for almost 10 years now. And Darla Van Groningen, who has served the Humboldt County area and surrounding communities as a therapist for over 25 years now.
Wow.
Darla kind of heads up the pulmonary rehab portion of our department, and she's just so compassionate. She's extremely patient, very, very knowledgeable. So we're very fortunate to have her on our team out at the hospital. In pulmonary rehab, our staff really just strives to maintain open and honest communication between physicians and patients. We kind of serve as that middleman so that we make sure the patient gets what they need in a timely manner. We also, provide support and continuous inspiration to our patients, and we help them set short-term goals. So a patient might say, I want to just be able to dress myself every day, and we can work with them on that. Long-term goals might be we want to exercise 30 minutes every day, so we work our way up to that as well. We cover a variety of education topics. We have a pharmacist come in and do a one-on-one consultation with you about your medications. We make sure you're using your inhalers the right way. Make sure you're using your oxygen safely. We offer smoking cessation, exercise counseling, breathing retraining, and then you also meet with our dietitian to learn how to eat well. And the list goes on and on and on. Every single patient experience is different. So we work in small groups, and we encourage patients to share stories, share their experiences. And a lot of times they end up making friends with other patients in the room, which is really nice. So pulmonary rehab does require a physician's order, but I just always encourage patients to either ask their doctor or ask us about it. We have a really good open line of communication with our doctors here in Humboldt, and they're always open to rehab if the patient is interested. So I guess we'll just close by saying that we're committed to serving with compassionate care in a patient-centered environment at HCMH. So please feel free to contact us anytime with questions. Our number is 332-4200.
All right, so that is Courtney talking about COPD and pulmonary rehab. Again, tomorrow is World COPD Day, so they're offering free screenings from about 8 to 4. So get on out to the hospital if you think that you might be experiencing some symptoms of COPD. And thank you, Courtney, for joining me on the Humboldt County Memorial Hospital Your Care, Our Mission show.